Breast augmentation is the most common operation we do here at ICLS. We were the first people to put in the cohesive silicone gel implants in 1999. When I talk to patients about breast augmentation, I divide it up into about 4 different questions that we're going to answer to tailor this operation to your particular needs. The first question is, what is the right size for you, your body, and your body type? Well, first thing I do is look at your examination. Look at your body shape. What is balanced with your body? So we look at your height, your weight, your body size, the width of your chest, the width of your breast. And these are things that are really important to look at when we're picking the right implant for you. Within those dimensions, I have so many choices. And it's really important that we communicate together what you're looking for as an end result. The second question is, where does the implant go? Above or below the pectoralis muscle? Well, that's a very individual thing. We have to look at your skin envelope, your skin stretch, your tissue coverage. We want to give you the best, most natural result that we can give you. And picking the position of the implant is very, very important. When I'm going through your exam, I'll highlight to you what are some of the pros and cons of going above and below the muscle. The next question we have to look at is, how do we get the implant in? What is the incision we're going to choose that's best for you? And there are many incisions that we can use. Our most common incision is underneath the crease. We can also use around the areola. We can do lifts. We can go through the armpit. There are many choices. And again, I'm going to take into account your body, your size, your shape, and together we're going to make that choice. When we look at implants, we have 2 main implants available to us in North America. We have saline. Saline implants are a silicone shell with salt water on the inside. And we have cohesive silicone gel implants, which are silicone on the outside, silicone gel on the inside. The implants that we use now are cohesive silicone gel. That means semi-solid, or kind of like a gummy bear implant. Cohesive silicone gel implants don't leak, even if you cut them. This is an implant that I've cut, and you can see the gel doesn't go anywhere. Some of the main reasons that I really like the cohesive gel implants are because of selection options. We can have teardrop shape or anatomic implants. We can have round implants. We can have different volumes of implants, medium, full, extra full, and really we can tailor these implants to your exact needs. Also, because it's a semi-solid, they tend to ripple less than their saline counterparts. Rippling is the ability to feel and see the edge of the implant, and that's much lower with the cohesive silicone gel implants than it is with the saline implants. But again, we need to decide what's right for you, and we'll make that decision together during your consultation. With breast augmentation, we need to understand what you're trying to achieve. We can achieve many different looks with augmentation. I can achieve a very full upper cleavage and round shape. I can achieve a very, very natural upper cleavage, very natural shape where no one will know that you have implants. So together, we're going to pick the right implant for you, for your body, and for your desired outcome. So many women come to see me after having some beautiful children who unfortunately may not have left our bodies exactly where they found them before our pregnancies. And when we're looking at breasts, we often find women have saggy breasts or droopy breasts, as well as a loss of volume. Sometimes this sagginess or this droopiness can be corrected with a simple implant. Sometimes we need to add a little bit of a lifting procedure, and that can depend on the size of the implant, the size of the breast, and the amount of droop that we have. It also really depends on your skin and your elasticity. We here at ICLS look at any surgical procedure as a journey together, and we look forward to meeting you here in consultation to start that exciting process.